Welcome to the first day of our iCON Health Forum. Um, our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Squamish, and Skalukit peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right. First of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Ho, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Ho. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today, this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many speakers who will share with us their information, and I'm not going to delay that process. But before they do that, I am very honored to be able to invite the representative from the Ministry of Health in BC as Lindsay R. Scott.
I would like to invite Ms. Lindsay R. Scott, who is the Director of Primary Care Quality and Primary Care Division of BC Ministry of Health. It's a huge pleasure to have her here join us today, and very kind to have her present to us opening remarks. So Lindsay, I'd love to pass this over to you, and thank you so much for being here.
Thank you, Kendall. Thank you for the opportunity to provide opening remarks at today's Chinese Health Forum, Take Charge of Your Health, Dementia 360. I'm Lindsay R. Scott, as Kendall said, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I'm located on in Saanich, and to the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Charter community located in Victoria. Patients as Partners is based on the motto of nothing about me without me. We believe that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. Patients as Partners has collaborated and funded iCON for over 10 years with Dr. Kendall Ho as the executive director for all of that time. When iCON started, they brought hundreds of people together to learn about managing chronic diseases. And over the years, iCON has continued to bring healthcare providers to speak to people in their first languages about topics people want to learn more about. This health forum brings together a number of presenters whose aims are to increase understanding of what dementia is and how to recognize it. Importantly, they will provide resources and strategies that you and your family can use to empower and optimize your quality of life. For me, today's topic is particularly important as my grandfather suffered from dementia. Having access to today's information and resources could have increased not only his quality of life, but my family's. I want to thank iCON for bringing us together today for this discussion, and I invite you to check out their resources after the discussion. Also, take a look at our patientsaspartners.ca website for other resources and more free educational events for patients and families. Again, I want to express a big thank you to our presenters today, and I appreciate your time and look forward to learning more. Thank you.
Great. Thank you so much, Lindsay.
Thank you again, Lindsay, for this opening remark and your support. And now I will pass the mic back to Barbara, and our forum starts now. Thank you, Dr. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is and what the symptoms are and how the importance of early detection and when you will need to seek help and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care and also other care aspects, which we will leave for tomorrow. That we're going to talk about is I would do it, and it is about.
So there are 6 points I would like to share with you. So I would like to ask Suzanne to help me with the PowerPoint. So yeah, virtual care. Many people before COVID, and many people do not have any knowledge about virtual care because there was not a need of seeing doctors and nurses by internet. However, during these 2 years, over 80 to 90% of patients have experienced virtual care. And sometimes it's between the family doctors and the patient and nurses with the patient. And usually it's the phone. But many people are using computer, just like using Zoom. So this is what we call virtual care. So when we talk about dementia, how can we get hold of virtual care? So the first one is if you have the access to virtual care, then the patient should be sitting together with a family member to see the doctor. Because in that case, we can have observation on not only the person who might have dementia, but we also hear the report of the family on the patient's day-to-day life. Because if you only allow the patient to talk with the doctor, you may not be able to assess. Now, the second one, there is one thing we cannot do. So we cannot go through internet to take a listen to your heart or to take a look at your symptoms. So therefore, there are 4 examples, which is very important. If you have these devices, then it would be very helpful to us doctors who are offering virtual care. The first one is temperature. So if you say, oh, I have a fever, and the temperature is very important. And for patients with dementia, although the person may have dementia, and then if there is a fever, there may be inflammation, and then it would make further deterioration of dementia. And therefore, we only think of the general situation, and also we would consider whether there is inflammation or infection existing in the patient. And if the family member can take a body temperature, of course, there are thermometers, and there are new devices like this one, which you put on the forehead, or you have an electronic thermometer and facing in front of your forehead and or into the ear, and the temperature can be taken. And this is our hope, that you have a device which can detect your body temperature at home. The second one is about blood pressure, which is very important. And we talk about the 3 highs. So this is one of the highs: blood pressure, sugar, and blood lipids. And for virtual care, because we don't have access to the patient, and having such a blood pressure monitor is important. And I hope your household would have that. I would like to introduce this website, hypertension.ca. Why do I recommend this? Because on hypertension.ca, there are recommended blood pressure monitors, because you can go to the pharmacy and you see different monitors. But there is one in gold color. You can see the gold check, and you can see different monitors which are being recommended. And for those having the gold tick, those will be recommended by the website. And the third device would be about heart rate. Very often, doctors would like to know the heart rate of patients. And during virtual care, the doctor may ask, well, what is your heart rate? And some people know what to do. They may put their fingers on the neck or on the wrist. However, some people may not know how to get a hold of their own heart rate. And sometimes because the heart rate is too fast, and it's difficult to really accurately count that. And if you have a device to help counting the heart rate monitoring, and just like nowadays, there are some health watches, then it's very helpful. And if you don't have that, you can download an app. And this is one of them. This is free heart rate. And if you go to the app store of your phone, and if you download this app called Heart Rate, then by putting your finger against the light, your heart rate will be monitored and taken. And also, you can also see not only the rate is 86, but you can see all those waves. So representing the rhythm. So see whether the heart rate is regular. And sometimes even for virtual care, and if a patient has downloaded the app, then I can see from their phone not only the heart rate, but also the rhythm. And the next one, this is not as common, but I do recommend every household to have one. And this is to indicate the oxygen saturation. This is important, especially when people are having fever, infection, or pneumonia, and then the oxygen level would go down. So normally 98% or above is good. And sometimes when the percentage drops, and it may affect the ability of thinking. So this does not mean that person is having dementia, but affected by the lack of oxygen. And I know many pharmacies do sell this kind of devices, but they run out very quickly. You can go on Amazon and then you can purchase them. And if you do purchase one and have one at home, this is a good protection and be very helpful. And nowadays, there are a lot of watches that offer detection of oxygen saturation. But to be honest, it should be detected from the tip of your finger or the earlobe. And if it is detected on your wrist, it is not necessarily accurate. And therefore, I would not recommend taking the oxygen saturation by watches. And the last one talks about one-touch video conferencing. So sometimes when we do log in Zoom, there may be 2 or 3 steps. However, on the market, there is what we call the one-touch video conferencing. Once when you purchase that device, you just touch it for once, or when people call in, just one touch and you'll get connected. And then you can join in the conferencing. And for people having mild dementia, so it would be much less challenging to use such devices. And the last one, the 7th tips. There is one audience who asked a question. They said that for people living with dementia, there is GPS. How can we make use of GPS? Can we use it for people living with dementia? Because people living with dementia, they may be loitering or wandering, and they do not know the way home. And on the market, there are some buttons, or there are some tires, or there may be a little keychain or necklace, which can track the location of people. And